My name is Victoria Corsano, and in this video I'm going to be demonstrating Trach Care. So the first thing I'm going to do is identify myself to the patient. I'm going to identify the patient using two identifiers. So we're going to do name and date of birth and verify that on the wristband. And the first thing I want to do before I start anything is explain the procedure to the patient. So the reason we do this is to keep the trach tube clean. It's going to prevent any clogging, and it decreases the risk for infection. Okay, so I'm going to put on clean gloves right now. And my first step is I'm going to prepare the suction. Alright, so we're going to pretend we have the suction on the wall. I'm going to turn it on. I'm going to set the negative pressure to suction less than 150, and I can verify that this is working by occluding the end of the suction before attaching the catheter. Alright, so we're going to put that aside and make sure that's working and that is prepared for us. Alright, so I'm going to take off my clean gloves. I'm going to wash my hands. I'm going to apply my sterile gloves. I already have my sterile field set up over here with the Trach Care kit. So go ahead and put on the sterile gloves. Alright, so with my dominant hand, once I get these gloves on. Okay, so with my dominant hand, I'm going to pick up the suction catheter, and with my non-dominant, I'm going to pick up the connecting tube, and we're going to connect that, okay? We're going to connect that to the suctioning catheter here. And with my dominant hand, we're going to insert the catheter into the trach tube. So we're going to remove the oxygen, and we're going to insert into the trach tube, and we're going to go until we feel some resistance, and then we would pull back 1 to 2 centimeters, and we would repeat that as many times as we need to do that, and we can reapply the oxygen after we're done with that. We're going to unlock and remove the inner cannula. So we're going to unlock it. We're going to remove that, and over here, we're going to get rid of this. I have my gauze, my cotton tip applicators, and the 0.9% sodium chloride. So we're going to put this in one of the holes in the kit here, and we're going to pour the solution in here. We can also pour it into another hole cavity there so we have more clean solution. So we dropped the inner cannula into the solution there. We're going to pretend that this is my sterile cleaner, and we're going to pick it up here. We're going to clean it like this. Alright, and we can also rinse it with the solution, hold it over the basin, and we can rinse. So we're going to reapply this back into the outer cannula, and we want to make sure that it locks back into place. Alrighty. So we're going to remove the stoma paper thing here. We're going to apply a clean one in a minute here. And we're going to take the cotton tip applicators. We're going to dip that. We can dip it in the clean side here of the solution. And we want to clean in a circular motion from the stoma outwards, and we would get new cotton tips as needed, the different areas that we would clean on here, and we would dispose of that. So the gauze, we can use the gauze if we need to pat lightly around the area, if we need to soak up any of the extra solution or any other secretions. So we can do that if we need to. So now we're going to put the new dressing on. So we'll apply the new dressing. And we want to make sure the tube is secured along with the Velcro straps. We want to make sure everything's in place there. We want to make sure we can fit a width of at least 2 fingers under the straps for comfort. We're going to assess the patient's comfort level and their safety. So over here, I want to make sure that I close my solution and I want to date it with today's date. And I'm going to put this away properly, store that away. And we're going to clean and dispose all of the materials that we used and dispose of them properly.